common phenomena. On a general ground, 50 to 100 hair follicles per day of hair loss is common, which are eventually regrown. So that is not an issue. The issue is when the hair follicles are thin, which do not regrow. This leads to the baldness that is commonly seen among male and females. Very commonly among male, which is called as androgenic alopecia. So in this situation, the ideal treatment of choice would be a surgical option. When we see the pattern of baldness, you have the scale, that's a Norwood scale from 1 to 6. The scale 1, usually a medical management would suffice. Now what happens from 2 to 5 or 2 to 6 is where one requires hair restoration procedures. Here at Sakra, we have a more advanced care towards hair restoration. Now why one requires hair restoration is basically to improve their body image, their self-confidence, which automatically is affected because of the baldness that they are facing. Procedures that we do at our hospital is a follicular unit extraction, a follicular unit transplantation also. In this procedure, we have a face-to-face conversation about the duration of procedure, about the type of anesthesia that we use. It is usually a local anesthesia with a minimal sedation so that the patient is at ease and is at comfort. Now, before the start of the procedure, the hair trimming is done for about 2 to 3 mm short. Now, this procedure is basically done as a daycare procedure. Patient is made to lie in a prone position and the follicular units are extracted from the occipital area, which is nothing but the donor site area. Now once after the hair follicles are extracted, we implant them into the area which are priorly marked, that is the area of baldness, are priorly prepared, and with meticulous and more careful implantations, these follicles are inserted into the bald areas. Now the post-op care is simple. It is just a regular spraying of the saline and some course of antibiotic and painkiller would suffice after the procedure. Now once the procedure is done, usually there is a pattern that happens. The hair follicles that are usually inserted, they fall off, after which the hair will regrow. So the procedure per se to get the good results is after 3 months. By this procedure, we aim to restore a more youthful looking appearance among these set of patients.